My name is Amanda Stevenson, and I would like to welcome you to Southeast Washington, D.C.
This is Southeast Washington, D.C., the waterfront and ballpark entertainment district, the corridor of commercial and retail development, the entertainment and relaxation mecca, and D.C.'s new food hub. But wait, it's Southeast, but this is not Ward 8. If you didn't know, there are two sides to Southeast, and to get to the other side, which is Ward 8, we have to go across the Anacostia River, the body of water that separates us from and over the bridge that connects us to food and economic access and opportunities. Take a ride with me across the bridge that many travel, leaving Ward 8 for food and economic refuge. Today, I'm taking you back to the 8th Ward of Good Hope that Martin the King dreamed of, on a food journey through the disparities, desires, and dreams of residents and other stakeholders. With resilience, they reimagine the broken system. As I am working to address the problem of how might we create a new and inclusive food culture to improve the health and wealth of Ward 8, where the cost of living is outpacing the incomes and life expectancies of many residents. To now realize a healthy and equitable food culture in DC, starting right here in Ward 8. As we examine the human relationship with food, we would see there are subtle messages in everything food related. Food connects global and local communities through culture, commerce, healthcare, and the culinary arts. We will see how we are defined and how we then define ourselves in terms of social class, ethnicity, and religion through our food choices. The types of food you choose, where those foods come from, who prepares those foods, seasoned or not, who sits where, who sits first, where we sit, how we sit, and even if we have a seat at the table. But wait, we cannot get up from this table without discussing what is the price of food, who's entitled to what food, and what ultimately is the price of health.
The cost of health? What do you mean? The cost of health. Maybe like a schedule, like see your dentist every month and like have a checkup every month too. And like you can like plan your schedule out any way you want, just recommendations, and you should always eat good.
I think the cost of health is too expensive for many people to afford it. So not many people actually can stay very healthy for long without running out of money.
We have to kind of recognize that throughout American history, food policy has been antithetical to indigenous communities and communities of color, and we saw a ramping up of that in the 1980s, where policies seemed to favor market and to move away from communities of color. And that's when you really start to see a declination in the kind of foods that school children were receiving. You see a declination in food economies and people becoming food poor, even though food was available in the neighborhood. And so I think that to fully understand that food economies, that there are multiple links in this chain.
The cost of health should be free. Even though I know that the doctors and nurses, all the people in the healthcare, social workers, they should get paid, but it shouldn't be as so expensive as if, like, let's say if I cut my thumb and I had to be rushed to the hospital, that shouldn't cost like $1,000 just to get it stitched back, or just a treatment for a tetanus shot. It shouldn't have to cost so much for something that everybody should have, and not take for granted, because some people don't have that and they're getting sick and dying, and we don't want any of that.
Health and healthcare culture is a local phenomenon that is heavily influenced by our collective history.
So I was in a Twitter conversation around what does policy look like for the Black community as it relates to food and health? For me, I see policy like credit. Bad credit, no credit is all the same. And that's how I see policy. We have had bad policy, we've had no policy, that all play a critical role in the systemic oppression that our communities are facing.
One of the things that I think that has been missing in this conversation is we talk about the contemporary, and the contemporary is meaningful. Like, why do people eat certain foods? But we don't dig into food culture and food history to better understand that food culture was an indoctrination in this country, tightly associated with slavery and slave economies, and so you kind of begin to kind of like unpack that and further understand that that foods that are antithetical to one's health were kind of like forced into indigenous communities and communities of color. We will have difficulty moving our understanding forward and to fully understanding the true economic cost of food and food-related systems.
When we look specifically at food, only till recently have many cities around the country developed food policy councils, where those policy councils not only monitor and track policies related to the local food economy, but they also are connected to the health and nutrition of our communities. And so that is why, at least here in DC, we must be a model in the nation's capital of what it means to not only have a fund to support local food businesses, but businesses that actually are healthy to our communities. Do we need more diabetic dessert companies on every corner next to the liquor store? No.
Fast food is all you see on TV. We're always constantly moving. I get something quick. And what's quick is not good for you.
The food culture is influenced by environmental factors and conditioning, which becomes social norms, that is, the behavior of a specific group in society.
It is so vital to our communities that we learn how to eat healthy, stay healthy. This will keep us from getting ill. Ward 7 and 8 still has some of the highest mortality and morbidity rates of the city. But we're also in an area where there's a food desert and we don't have access, as is the case for the rest of the district.
Food-related economies are part of a set of acute building blocks for creating and sustaining good health. And that occurs at the personal and at the community level. This is tightly associated with living spaces and the environment as well.
There's not a lot of gym facilities in the Black communities, and a lot of them aren't affordable. So affordable fitness, access to healthy foods is something that a lot of Black communities do not have, specifically Ward 8 and Ward 7. So you have a lot of young people or adults that have never been around fitness, they've never been around health and wellness. So all they know is just living everyday life. So a lot of it's exposure. The other piece is access.
People are affected by social norms, public messaging, media, and advertisement, and how it portrays foods as social norms and how it impacts our dietary habits.
If a mother who is unable to pay for childcare, who's unable to go to a job to make a minimum wage of $15 that people are advocating for to pay for the subsidized care, she sometimes may have to choose between how does she pay a bill and to heal the meal of her family. This is the dynamic that we're in right now, and that is why this is a problem.
Okay. Generally speaking, in terms of shopping as a mom, I try and find things that are like affordable. So if I'm like buying clothes for 3 kids or buying toys or whatever it is, I'm trying to find things that will fit within my budget so that I can, have everyone dress, whatever it is, and make sure that I'm not spending too much money to do so.
When I grocery shop, the first thing I will say is I never look at price. I don't put a price on what I'm consuming in my body. I'm looking for quality. I love experience as well when I'm going to the grocery store and I'm able to taste different products, new products and things of that nature. But I think that we have to really rethink how we think about the food that we consume. Sometimes we try to bargain shop for what we're putting in our body, in our temple. So when it comes to grocery shopping, me personally, I never look at price because I want to purchase the best quality of food possible.
So in terms of food, I have a different philosophy, and I'm sure my other shopping philosophy should be the same way, but I kind of think that if I spend this money up front on good quality food, I'll spend less money going to the doctor and being sick when I'm older.
So, what is alkaline soil? It is basically soil that has a higher pH than most other soils. And today, I'm going to show you how to make your soil more alkaline. You need water and baking soda. Put 1 tablespoon of baking soda in a gallon of water. Then shake. Get your dirt and plant your seeds or cuttings. Pour mixture in growing soil and use it to water plants. You can also make water alkaline. This time pour 1/8 tablespoon in 8 ounces of water, then stir. According to healthline.com, benefits of alkaline water consist of regulating body pH to prevent chronic diseases, and it supports the immune system.
When I think about how the basic needs of life are food, water, and shelter, these are the things that help build the foundation of a civil society that we basically pay taxes for our government to ensure that we have not only institutions and to build economies, but also those that support our societies. And that's where societal protection programs are so critical to ensure these fundamental rights of food and health access, because they are intrinsically linked together.
And I think that, racism, capitalism, poverty, sexism, all of those things contribute to people, not having access to resources, not having access to land, not having access to healthy food, not having access to, jobs to be able to pay for things.
That's a plight of a lot of residents as well as resident-owned businesses. So this leads us to addressing the overarching problem, and that problem, as reported, is the decline of the life expectancy of our residents, as well as the shortened lifespan of Black and minority-owned businesses east of the river and in other urban areas around the nation. These residents and business owners, as you know, suffer from inequity in access and opportunity. So how might we be, have, and stay? How might we position these minority-owned businesses to be at the same level as other leaders in the food industry, to have access to the same capitals, tax incentive, and et cetera, to ensure they stay in the District of Columbia?
One of the challenges that I've faced with starting a food business is that because my food has items that don't qualify to be conducted at home with the cottage kitchen policy, I must operate from a commercial kitchen. Living in Ward 8, that's a true challenge. So the commercial kitchen that I operate from is in Northeast DC, which means I have to go across the river for operations and not actually do business right here in my community. I find that in the northeast side of DC, I forget the ward, I think it's Ward 5 or so, you have more of where the food hub is. There you have the commercial kitchen. On this side of the river where it's Ward 8, you have restaurants here who are brick and mortar companies. They're freestanding, and they are not for foodies like me who are caterers or meal prep providers who need to operate from a commercial kitchen. So in order for me to conduct business, I have to go across town to do this. It would be so awesome if this was available here in our community.
There's a lot of people within our community who make their own products, which are healthy as well, that we can sell in our stores, in our community, and circulate the dollar within our community.
We're working to address these health disparities through food access and through housing. So we all need to be mindful of how the offspring of resources has genetically modified the entrepreneurial organism, and that is the Black minority business in the District of Columbia and beyond. We need to have a culture of equity. We need to make sure that we give minority businesses the same allotments of grants, tips, ownership, and lease terms as given to renowned operations that have already been positioned to thrive.
One thing that I think people have to understand is that small business owners really are heart of the economy. You know, we're the first impacted when something happens, such as this pandemic, this COVID-19. The hardest hit have been really small business owners, especially minority-owned businesses. For this reason, it's so essential that we are equipped with the tools and resources we need so we can be successful. When small businesses are successful, the economy is successful. Small businesses, we employ the community. Most of the people that work for us come directly from the community. And if we are not able to operate, that means members of the community also can't go to work.
Currently at the Fresh Food Factory, we make sure that everyone has access to healthy and ethnic foods, no matter their socioeconomic status. We sell affordably priced, healthy, local, and ethnically infused foods, and we are member-based.
We need businesses that are providing those high vibrational foods that I talked about, the fruits, the vegetables, remixed in a way with our culture and nutrition in mind and flavor. That is the future of what food should look like, and that is why, as the founder of Wanda, I see that the future of food is female.
We are the first female-owned, Black-owned, healthy and ethnic food market in Southeast.
We need not only our women to see that our kitchens are healing spaces again, but we need policies to reinforce that, to ensure that we have a pipeline of more nutritionists of color leading into the food system, that we are in essence providing culinary reparations across the food system to acknowledge the labor of Black people helped to build this very system that we are operating in, and it's broken along with our trust.
I think the issue is, it's a lack of social capital when it comes to advocacy for food equity. We have to come together at one accord and start putting together strong advocacy against the disparities that are in our community. We have to be firm. We have to not let up. And we have to ensure that, we're not overlooked. And that's going to take unity. That's going to take education. That's going to take organization. But I think it's possible. There's no way that you should be able to walk right across the 11th Street Bridge and have access to so many healthy options when it comes to restaurants, but they lack here in Ward 8. So I think it's going to take strong advocacy. It's going to take a lot of consistency, but I think the time is now.
To build back better, a system that is inclusive of all, providing opportunities not at just the base of the pyramid, but at the leadership and ownership level, then we need to ensure that access to capital is present. We need to ensure that there's equity and fairness in the labor force in terms of pay and treatment, but also in the treatment of the very plants that we consume too. And that gets into sustainability and agroeconomy that many people have discussed, along with understanding that even at the hospital level and the clinic level, you should be able to have a nutritionist be able to refer you to continuity to care in the community, whether it's to a teaching kitchen that is helping you to remix your meals to help battle your heart disease with your culture in mind, or providing your children with nutrition education in your classrooms and helping to grow healthy gardens in our communities. This is what the future of food should look like, and it should be painted with positive narratives and images of our people reclaiming not only our culture, but our foodways and our health.
And if we can get more people to stand firm with us to, fight against this crisis that we're dealing with in regards to food equity, we can start a powerful movement and change some things here in our world.
The real question is America ready for Black people to be healthy?
No longer should people have to leave Ward 8 to seek food or economic refuge. Now you are in the driver's seat. We hope that Feed Ward 8 drives you to change and to share your stories. Capture your insights, actions, and impact and send them to our team. Like us, follow us, subscribe, share, hit the notification bell, and DM us videos and screenshots of the change that you are making for yourselves, your family, and the community. We want to show everyone around the world that you have taken action towards a new and inclusive DC food culture. The person with the most engagements and creates the most positive change by Tuesday, April 27, 2021, will be honored as our community hero or shero. The renowned portrait artist Luis Peralta del Valle will paint an image in your likeness, and it will be hung at the Fresh Food Factory's market alongside other heroes and sheroes for all to see.